We have an information assistance line. It's just free to the public. When you call Link, a lot of times they'll refer it to us if it had to do with seniors. Same thing with the Mayor's Action Line. They'll refer those calls to us because we keep a list of what the facilities are like, what services are available. And that's usually what people have trouble with, is figuring out, what do I need?
And since you mentioned like housing and health care, how are those needs being addressed?
You know, one of the problems is when someone reaches 55, 65, 75, and they're looking for housing. That's also when they're on a fixed income, right? Either they're retired, or they're just not working, or they're sick, or whatever. So that there are places to find lower income, but one of the things that we do is go look up, is this person a veteran, right? Was their spouse a veteran? Were you married to a veteran for more than 10 years? If so, that helps with monthly income that you may not have applied for. You know, so some of those basic things of how can people qualify to get into housing they can afford.
Yeah, wow, that's good. When it comes to low vision, what exactly does that mean?
You know, we do two things that are related to low vision, and one is we house the Alliance for the Blind. Very often that's seniors that it affects, and that's kind of how we ended up there. People with diabetes. There are a lot of people who are not necessarily blind, but just have low vision. And have a lot of trouble managing life. One of the newer programs is actually an occupational therapy, right? And so it's someone's already lost a lot of their vision. They have macular degeneration. They can see some things, but not everything. They don't enjoy reading the paper anymore. But the therapy is working with them every day on, what can I read? Is there something that I can work around? Are there any tools that I can use? And a lot of it's just getting big print, right? I mean, that's one big step. But there's a lot of things to being able to cook for yourself and get around the house and get on and off of the bus and know you were charged right. And so a lot of that we help with.
Right. Wow, but I guess I am kind of concerned about the paper, like you mentioned. Correct me if I'm wrong, but does the paper, our local paper, presently have a bigger font or a bigger print?
I don't know if you can get a different version for it. You can actually get readers, right, which is a device that'll read it to you.
Oh, really? Audibly?
Yeah. And, you know, traditionally those were thought of as a blind device, but really anyone could use them. Those are very helpful. You know, you can get a large print Bible. You can get large print in a lot of things. The newspaper, I haven't seen one.
No, me either. Maybe they should come up with something on that, huh? What are home health services, and what could cause a senior citizen to need these services?
The term home health actually relates to Medicare, right? And so for us, it's someone who's got Medicare or has VA benefits. That is it's skilled nursing, right? It's physical therapist, occupational therapist. Occupational therapist actually helps you with things like, right, I mean, really basic, do I need rails in this room? How do I get around? How much help do I really need? That type of service, though, it's an in-home service. As long as the doctor referred you and you were, you don't necessarily have to be homebound, but you have to be restricted that when you go out, it's a lot of work. That you went out and it was really a burden to go grocery shopping. I mean, it was very difficult to do that one task probably for the week. And within 60 days, we should be able to help them either recover from an illness or recover from surgery or improve their ability to get around and take care of themselves so that they're more manageable. Usually it's 60 days, sometimes 120, but that's it, and that's really the only purpose of that service.
Would a mobilized wheelchair be one of those? or fit into that particular service?
Well, they call them those like durable medical equipment.
Okay.
And so it may still be covered under Medicare. We wouldn't provide it, but we would help someone find how do you get that.
Right, right. And you mentioned that some of the services were occupational therapist, and what was the other two?
Physical therapist.
Physical therapist, okay. And how does that help being in home?
Physical therapist may help with it. You've just had a surgery on your elbow,
Okay.
and so it stiffens up, right? But they may prescribe immediately when you get home from the hospital that home health is going to come out, send a physical therapist to evaluate you, and then give you a series of either exercises, or they'll come manipulate the elbow so that it doesn't become a permanent problem. Occupational therapist is really more concerned with, are you able to get in and out of the bed by yourself? Right? Can you make it over to the kitchen? Are you at risk for falling and hurting yourself? And they address those issues. But we also do, we have a nurse who focuses just on wound care, right? People recovering from a surgery. And that's always a problem when someone becomes homebound and really is in one place for a long time.
Okay. What is the Homemakers apps program?
The Homemaker program, we've had it probably 20 years. I've been there 17 years. It is, it started off years ago as a way to keep people out of nursing homes. Right, to let them stay in their home, near their neighbors, people that they know. Because one of the things that's very traumatic is when all of a sudden you have to move, and you don't know the new people, even if they're going to take care of you. And so the program was focused on that. Over the years, it's gotten smaller and smaller, and I'm not sure why that is, but it's less popular now to help someone stay in their home, at least in terms of us delivering service, so that almost everything we get comes from Adult Protective Services, right? A neighbor called in and said, I think the kids are taking advantage of her, or someone's taking her mail every day, or whatever it is. But when they investigate, they see, a house that is covered with clothes that haven't been washed, dishes that haven't been washed, animals maybe, but who knows? And that person doesn't realize how bad it's gotten, and they don't really have anyone to ask, and no one's checking on them. And so if they, Adult Protective Services calls in and says, we need someone to go, and we can get them into the system, then we'll send a homemaker. And they'll go out, and we may only be able to give them 3 hours a week or 6 hours a week, but during that time, we can make sure the place is clean, and that the phone service is on, and and help them with some of those basic things of how they get a hold of their kids. So their kids live here. Are they still involved with their church? What's their contact at this point?
That sounds like an awesome program. But let me ask you this. Did the downturn of the economy affect finding jobs for senior citizens?
Yeah, it meant more people applied with us, but especially the seniors program. That program takes in seniors, places them with other charities or nonprofits to help them gain job skills. They can earn some money, but really the goal is within 2 to 4 years being able to find a job somewhere else. So when the economy turned, all of a sudden we had a lot more seniors who needed money and didn't have jobs, and there were more people than jobs. At the same time, the seniors in the program are trying to find work, and there are fewer employers looking. We still managed to succeed, and we help people work, and it continues, but it got much tougher.
Yeah, I bet. How can seniors find out and qualify for any of these services?
Well, like I said, the information assistance line, which is our main number, 766-0600. When someone calls there, they're just going to figure out, do they need to talk to a social worker? Is it, and it's not necessarily for services that we provide. It could be for anything that's available in the city. Someone just wants to know what nursing homes are in my neighborhood, right? And we can get that information, either mail it to them, email it. But it's nice to have access to someone
Oh, yeah.
and answer questions.
Oh, yeah, I bet. And speaking of which, are there any final words that you would like to share with the senior citizens or the viewers that are watching?
I know that with my mom, one of the questions that she was asked is, well, how do I find out what's available? And she knows where I work, but she gets a lot of stuff in the mail that says, here's this kind of service. Here's where these dance classes are. Here's where, and she has a whole bunch of stuff on her kitchen table. It's not always easy to figure out where are you and what do you need. And so being able to talk to someone's great.
And which is best, huh?
Yeah.
Because
it's the best starting point.
Yeah, if she's got a table full of mail, it is best to contact an office such as yours.
And sometimes her table doesn't have every answer.
Yeah. Especially that's in her best interest, huh?
Yeah.
Yeah. Thank you so much. Well, once again, you've heard it yourself from Mr. Jeff Weesner, Chief Administrative Officer for Meriden. Thank you so much for being a guest on Join Our Town. I do have to take a very brief break, and I'll be right back.